tell me again the name of that homeopathic for sleep?
Ignatia.
Yes, maybe I should take
IGNATA.
Okay.
You need some too. When in doubt,
And
take some.
Alan needs, he doesn't sleep
Okay.
well.
So what did you want to talk? Did you want to talk about respiratory issues, or did you want to talk about something else? Did you want to talk about?
We just want to, I don't know, I mean, it's good to know about
Good to
the,
know about
the
stuff.
real stuff about the coronavirus.
Oh, okay, sure.
I mean,
The real-
I don't know,
yes,
for me, because
yes.
it's like,
It's
so
not
much-
real to begin with.
Yes,
Well,
yes.
that person was started talking about it, and I've heard all these like
It's crazy.
conspiracy theories and where it came from. And I was
Biggest
like,
con so
yes,
far.
yes.
Coronavirus? Yeah.
and do you know what the origin of it was? Somebody was saying.
Nobody knows.
Nobody knows.
Knows.
Nobody knows. It was definitely not from the wet market. It was not from the Wuhan seafood market. They looked at all the 137 cases. None of them had originated.
I've heard
So
a few
there's
conspiracy
the lab.
theories.
There's the bioterrorism lab in China, in Wuhan, where they're making a lot of this stuff. But who knows? Who knows where it came
It's like
from?
the world
Yeah.
on the brink.
Yeah. But the point is, let's not panic. Look how little traffic there was on the road.
That's wonderful.
Easy
I love
peasy.
going out these
It's,
days.
we
Yeah,
have
I've
this.
been
room
out
for
to
ourselves.
meet a few times this
Yeah.
week.
Yeah.
I'm still here.
So that on 11, I did this PowerPoint. On the 11th, there were 126,000 cases and 4,600 deaths, which means, it's like between 2 and 3% mortality. And, cancer kills thousands of people every day.
I know they say 20,000 people
Suicide
die.
kills
Yeah.
many, many more times every day. So
Yeah, I think it's
then before we-
3,200 in car accidents every day.
Yeah.
Why do you think Italy's so hard hit?
I think a lot of these people are vaccinated. One of the
Okay,
biggest risks
okay.
for coronavirus is prior vaccination.
Okay.
In Wuhan, they rolled out mandatory vaccinations, right?
December 1st.
December.
Flu
Yeah.
vaccines?
Or many more than flu. And especially the flu vaccine
And pneumonia
increases your
vaccines.
chances of pneumonia and coronavirus.
Yeah, the influenza.
Influenza
strains.
strains,
Okay.
When you encounter
Pretty dramatic.
Okay, that's good to know.
corona, you tend to get
Yeah.
more sick.
So rather than talking about how the coronavirus came
just-
about and what happened and are we going to die or not, let's look at therapies, cures. And a very good homeopathic cure for what's proving to be the similar set of symptoms is a remedy called Arsenicum album, 30C. You take 3 doses like this in a day, and then every week you sort of repeat, and if you feel symptoms coming on, then you can take it more frequently. The way this is going to work, homeopathic medicine works, is the equivalent of throwing a pebble in a pond. You want to throw it right in the center, at the right velocity so that the ripples go out into the entire pond. So think of that as an analogy for how homeopathy works. It's not suppressing anything. It's not actually curing you. It's causing your body to cure itself by increasing that ripple, the ripple force, the ripple effect in the pond. And so you have to have the right remedy.
Yeah, I can take that later. I just wanted to understand how you do the wet.
Oh, yes. So for the wet dose, here's a remedy. So
You
you
wrote that in an email,
Yeah.
and I
You
didn't
take-
even include it to Andy because I wouldn't
Understand
understand
if
it.
it wasn't screwed on, wouldn't I?
You take 3 or 4 of these. You take pure water.
What is that?
This is the remedies.
Oh, okay,
Yeah, so this is the remedies. These are in pill forms or granule forms, little poppy seed sized pill.
Okay.
You take 3 or 4 of these, you put them in, you put in 6 to 8 ounces of water, you stir vigorously, and that is an ultra dilute solution of Arsenicum album. And you're going to take, a few spoonfuls of it. Give it to your whole family. What Hanuman did when there was a scarlet fever epidemic in his town was he literally went door to door and he gave this to people, and nobody in his town died from scarlet fever. And in all the nearby towns, the mortality rate was 30, 40, 50%. So these are
This
powerful.
particular thing.
Belladonna. The remedy for scarlet fever was belladonna.
So you said how many sips do you take during the day?
I'll just take 3 sips during the day, and then I'll leave it in the fridge or something, and take another
3
dose
sips
next week. Yeah.
until it's finished.
how many you put in
Every
once?
Not
a week?
every day, just
Oh,
take one shot once a week, three
Okay.
spoons once a week.
Okay,
And then
that's what that is.
that's what that
Okay,
is. And if you feel sicker, then of course you start to take it more frequently.
How many pellets?
3 or 4, literally 3 or 4, yeah.
3, 4 sips
Of these,
a
yeah.
week.
3, 4
Just
sips
to
a week,
sort of-
yeah, it's a prophylactic, yeah. Yeah. To get your system in a place where it'll be able to fight the disease. And the key is not to avoid the fever, the cold, or all the symptoms, but to reduce them to the point where it's like a bearable cold. Yeah. And so, based upon the symptoms of the coronavirus, we have a few remedies. Is this on? Yes, it is on. We have a few remedies that are appropriate. So if your patient, a member of your family, is restless, arsenicum is chilly and restless. Restless, anxious, chilly, a thirst for small quantities of water, frequent small sips of water, sunken face, cadaverous, Hippocratic, a very tired and exhausted and ashen face. You have stomach anxiety, thirst for small quantities of water frequently. There may be, if it's gastrointestinal, there may be vomiting, diarrhea, dry cough, hacking, asthma, like from dust. Like there's a particle of dust in your lungs. Tickling in the larynx, loose during the fever. The cough is loose during fever. Evening, lying down. It is high cough, so you have to sit up. Salty expectoration during the daytime only. Frothy, bloody mucus, frothy band around your chest feels constricted. You feel like there's a band around your chest. So these are very specific symptoms, and they vary from remedy to remedy. And so what we're doing right now is a sort of a study group, right? So we're going through all of these, and these are people who have taken this remedy when they were well, and these were the symptoms they had. And the principle of homeopathy is like cures like. So if you give that same remedy when the person has those symptoms, it's curative.
So you will get this reaction if you start.
If you're a healthy person
Okay.
and you
Yeah.
take a lot of this remedy, but nevertheless, this is a very low dose. This is prophylactic. You're not
Okay.
taking it regularly, and to the extent you have a coronavirus or a influenza coming on that resembles this would be the right remedy. Heavy heart anxiety, heart palpitation. And there are some people for whom this is a constitutional remedy. So when there is an epidemic going on, you can do two things. You can take a remedy exactly based on the symptoms of that epidemic. You can also take a constitutional, which is specific to you, and that'll help cure. Because for you, the weak links in your chain are related to that constitutional remedy, and it'll cure. So there's two ways of looking at this. Either you take the genus epidemicus, which could be this, or Gelsemium, or Nux Vomica, or you take your constitutional. And that'll sort of ameliorate the exacerbations of that disease. You will not die from it.
How do you know what your constitutional remedy would be?
And that's the study of homeopathy. Yes.
Oh, okay.
So that's what when you look at some of the descriptions, this is the repertory. This big fat book is the book that I consult when someone calls and says, I have a twitching in my right nostril and my left sciatica hurts and I stumble around and I have diarrhea. So you start with something that matches one of those symptoms. You take all those, it's like baking, it's like an algorithm. It's literally, if you had a software program, you'd arrive at the answer in no time.
Wow.
And so then you take that list of remedies, then you shrink it down to the diarrhea remedies, then you shrink it down to the right nostril remedy, and then you have your remedy. And when you do it this way, it works. It works. So yesterday, my dog was stumbling around in the morning. She's pretty old. She's pretty old, and she was very damaged, vaccine damaged, and she was tumbling around, and she did not have appetite. And you know, when it's your own dog, you kind of panic. And so I just looked up there, stumbling gait, glazed eyes, loss of appetite, and agaricus came up. Agaricus, the mushroom. It's the mushroom. And I gave her 30C. By afternoon, She had an appetite. She ate all the food that I gave to her, and she was running around. So it's hard to argue with those kinds of results. Because Roxy, I thought, oh my God, is she gonna die now? And she wouldn't go for a walk in the morning with me. She was standing and going like that.
Yeah.
And so it's very useful to have a repertory. The repertories are online and they're for free, so you can use those as well. But to get back to your constitution, you could go to another person who's not related to you, who can observe you better, because sometimes you have troubles reading your own constitution. But many people are very self-aware and know what they're like. There's some people whose constitution you can clearly see. Some people who are a mix of things. Like, do you get chilly? Do you get overheated? Do you get hot in rooms? Do you get claustrophobic? So these are sort of traits of the mind, the physical body, and all that help you determine your constitutional remedy. So back to our Seneca. It's heart constriction, palpitation, heart anxiety, heavy, tired limbs, anxious dreams, sleepless night before and after midnight. So the arsenicum is sleepless, I think 12 to 2. And so if you get up 12 to 2, you're likely in arsenicum,
Unless you go to bed at 6.
Unless you go to bed. So take all that into account. Arsenicum is thirstless during fever. Usually they're thirsty, but during a fever, they're thirstless. Then the fever alternates with chills, perspiration at night with anxiety. When you wake up, sometimes post-menopause women do that. They wake up at night thumping, heart thumping with anxiety. Happen to anybody? That's arsenicum is great for that, as is lachesis. Sour odor to the perspiration. Walking aggravates puffy, swelled face, and swelling under the eyes. If you have bags under the eyes, it is arsenicum, apis. If you have bags on top of the eyes, it's kali carbonicum. So these are things, as you read more and as we meet more, they will become your friends. The remedies will become your friends. It's not at all difficult. And you'll go, boop. And women tend to be very intuitive about these things. You'll figure things out pretty fast.
Can I ask a dumb question?
Please.
If you have some of these and it's not related to the virus, can you take these if
Yes,
you have like
absolutely.
mucus and
Absolutely.
Okay, that's
Yes.
I wasn't sure. This
Yeah.
is just
And a good way to think about it is as a three-legged stool. So one emotional symptom should match. So there are emotional and physical symptoms, right? One physical symptom should match, and one mind symptom should match. That's what they call the three-legged stool. And if a lot of the symptoms pretty much match, then it's a good match. And arsenicum is not the only remedy. There are hundreds of other remedies you could take that will work to a lesser or greater degree depending on the kind of person you are. So everybody with coronavirus is not going to have these, right? And so I'm going to walk you through 3 remedies. Is that okay? Or if you don't, just take arsenic. Just take the first
So
one.
even if you're allergic and have some of those symptoms, you can
Yes.
still-
Yes, absolutely.
Is the arsenicum easily available, like if we go to Sprouts or
Oh, there was a run on stores. My friend Karina couldn't find them. Yeah, not in store, online. So I had to ship her from the Sebastopol Whole Foods. Yeah.
But is that usually common in a store?
Yes.
Okay.
In those Boiron bottles, you can find it. The second remedy is Nux Vomica. You're going to find that there are some people who are more Nux Vomica than arsenic in their coronavirus. These are people who feel sick after they've had an angry tirade or had an upset. They get this ailment after a vexation, after a fight with someone. Happened to any of us? You suddenly feel sick. Anxiety after eating, in particular. You feel not so well. Mind, you have difficulty studying, reading, you have impatience. You're sensitive to light, music, noise, everything. You're just sensitive to sensations. It's like the feeling of being hungover after a night of partying, of too much alcohol, of too many rich foods or spicy foods or whatever it is you can't digest. It's a fabulous remedy for that. Or a sickness that comes on after these kinds of things. vertigo. They hold their heads while coughing. Morning cough, typically, not night cough. Cough is dry during fever. You feel kind of hungover. Your head is heavy in the morning. There's discoloration of the face, right? Bluish, reddish, yellowish, bluish circles under and around eyes. See, arsenicum doesn't have blue circles around the eyes. Nux Vomica does. Chest and heart palpitation after eating, particularly related to eating. After eating, you feel sick. After eating, you feel, or after anger or vexation, or lying down, bloody expectoration and nosebleeds. Stomach pain in the morning, so more morning-oriented symptoms. Warm drinks will make you feel better. The abdomen is distended, so swollen abdomen. Cramping, griping, liver pain, either constipation or diarrhea, or alternating. Bloody stool, cough in the morning, on waking up. Back pain in the lumbar region. That's a good sign. Arsenic doesn't have that. Arsenic doesn't have constipation. Arsenic has more diarrhea. This is more constipation. This is more men. Many men tend to fall into this, but not always. Sacral, cervical pain in the morning. Falling asleep while sitting down. In the evening, trembling extremities. Cold hands during chill. Formication in the limbs. You feel like ants are crawling under your skin. Many people get that, yes. Extremities. Pain during chills, and the fever alternates with the chills. They have an aversion to uncovering, so they want to be huddled in their blankets. Nux Vomica. And do you get a sense of the picture of a Nux Vomica person?
I guess so, yeah.
Once you read it enough, it'll sort of raise the specter of that's a Nux Vomica. Oh, that's an arsenic. Oh, that's a Gelsemium. So just a few remedies.
A little bit of everything here.
Yeah. Or it could be a mix.
You have to take the whole
The other thing is it's hard to prescribe for oneself. I find it hard to do things for myself unless they're very clear, like I have a bruise or I have a fever, because your judgment is impaired when you're sick. So it's a good idea to have a study group or have a bunch of people who say, "Oh no, you're Nux or you're arsenic, you're sulfur," and for the following reasons, because sometimes it's hard.
So generally your constitution is
One of
remains
those.
the same.
Yes.
But then when you're sick, you get more of those symptoms.
More of those symptoms,
Okay.
exactly.
Yeah.
And so, did I not put Gelsemium? There's another remedy that is also rather nice, and that's Gelsemium. When you feel really slow, when the flu comes on and the coronavirus comes on slowly, your eyelids are droopy, you don't want to be around people, you're mopey. You're not anxious, you're mopey, you're depressed. It comes on slowly. That's a Gelsemium virus.
So Gelsemium.
GEL. Gelsemium. Everyone for the flus needs to have some remedies on hand, I would recommend. So you want to have an arsenicum on hand. You want to have a Nux Vomica on hand. You want to have a Gelsemium on hand. And you want to have what is called a Banerjee protocol for flus, which is Aconitum 200C, Bryonia 200C. Start at the first sniffle, fever, or ache. So if you don't want to think too much, if you don't really know what is happening, if you want to protect yourself, this is the first line of defense, and it's a very, very good Banerjee protocol, and it works for about 80% of the people out there for your common flu.
You'll be sending us.
Yes.
I will be sending you this.
Oh,
Yeah, I'll be sending you this. And so, what you do is you take a couple of pills of the Aconite, a couple of pills of the Bryonia, put them under your tongue together. And you continue to take it several times a day if you're sick. This is only if you're sick, if you're feeling sick. And you'll abort the disease, or it'll be very, very mild. And I have experienced it when my grandson was here in December. I had a sore throat, and Richard got sick, then I got sick, then Katie got sick. And what worked for me was this protocol, Aconite and Bryonia, and surprisingly, Ignatia worked for me, for my sore throat. Because my sore throat would come on in the evening. It would come on when I was bathing. Bathing gave me a sore throat. So Ignatia really helped me. And I would get this tickle when I lay down. So it's different things that work for different people, but this is a protocol that will definitely help you. If you have severe bone pain, like so painful that the insides of your bones hurt, that is a Eupatorium. And the Woodlands or Good Earth should have those. I know the Whole Foods in Sebastopol has all of these.
Sprouts, maybe.
Sprouts maybe has them. And if they don't, you can buy them online as well. Another great flu protocol is these three things mixed together. Aconitum, Gelsemium, Eupatorium, 30C each. And this is a formula that's sold in the UK. It's called AGE and ABC. There's two formulas. One is Aconite, Gelsemium, Eupatorium. This is for when you have a flu that happens from cold winds, you catch a cold and you're suddenly feeling sick, you're feeling mopey and dopey, and you have bone pain. That's an AGE. If you have very high fever, then take it, and a cough, then take an ABC, Aconite, Belladonna, and Carbo-Veg tablets.
So, do you take the ABC or the AGE at the same time?
Same time, yeah.
They're all 30Cs. Too.
All 30Cs. Smaller potencies are fine too. You can do 6Cs, 3 6Cs. In fact, they might work better.
So how is it? The smaller are more powerful? Is that
The
it?
smaller are less powerful. The larger potencies, which are more dilute, are contrarily more powerful.
Oh, that's it.
They go into the deeper envelopes of your body and mind.
Nice.
But at the same time, when you're very sick and you're very weak, a smaller potency will not aggravate. A higher potency might aggravate. So you got to play it by ear. And I would recommend you get smaller potencies for the AGE and the ABCs, like 6 or 12 or 6 even. And then you're just taking them all at once. This is a very specific Banerjee protocol, works great. If you just have bruised feelings all over your body, there are flus I've had when I just felt bruised. That's Eupatorium. And then these are things specific to each remedy and what it does. Aconitum is a shock remedy. If you're suddenly subjected to very cold air, very hot air, you were in trauma, you're in an accident, you saw someone being murdered.
No, I was just stretching my hands.
Within 24 hours of a shock or an acute illness, if you take an aconite, it has prevented heart attacks. It has prevented major illness, chronic illness that was triggered from a shock. Death of a loved one, accident, trauma, things happen to you. And sometimes an unraveling happens, You're fine, and then something that is the last straw breaks the camel's back. You have to know that and take an aconitum. It will make all the difference in the world. It can halt heart attacks in their tracks. Hemorrhages, shocks, strokes. When in doubt, take an aconite and arnica. Just keep it handy. The potency can be 30, 200C, or 1M. And it's a good idea for people to keep that. One of the things you don't want to do is to go looking for remedies at midnight when you're in a traffic accident. You need to have those things on hand in your first aid kit so that you're always ready. Or if you have surgery, you need your Staphylococcus aureus, your Hypericum, your arnica, your aconitum handy. So aconitum is for fright, shock, accidents, bad news, cardiac arrest, death of a loved one, sudden violent injury, sudden fevers, and so on. Vomiting with fear, profuse sweat. You're very fearful. It's different than arsenic. Arsenic is restless and anxious. Aconite is fearful, shock, sudden trauma. So fear and anxiety, constant pressure in the left chest, palpitations, hot hands, cold feet, nightmares. You know, if a child has constant nightmares, give them an aconite. Bryonia is for physical weakness, all-pervading apathy. You don't want to be touched. You just want to take the blankets, pull them over your heads. You don't like to be mollycoddled. You want to be left alone with your fever and your pain. That's a bryonia person. They're worse by motion, better by rest. That's the key. Some people feel better after they start walking in the morning. Some people feel worse. The worse is bryonia. The better is, say, someone like a Russ talks. Oppressive headaches, parched lips, excessive thirst, so huge amounts of thirst for large quantities of water infrequently. Arsenicum is small amounts of water frequently. Bryonia is large amounts of water infrequently. I just got thirsty. Bitter taste, sensitive epigastrium, rheumatic pain, swellings, soreness in your larynx and trachea, hoarseness in your voice, dry hacking cough from irritation in the upper trachea, cough that's dry at night, you must sit up, worse after eating or drinking, and with vomiting. That's a bryonia. Oh, I had Gelsemium. Thank heavens. Okay, this is the third one. Genus epidemicus. Your cold or your symptoms, your coronavirus, whatever it is, develops symptoms several days after exposure. And this is a virus that has a very long incubation time from what I read. Anywhere from 7 to 27 days. So you got exposed to it 20 days before, it's someone you bumped into from Wuhan, and now you're feeling sick 20 days later. That's Gelsemium. The reaction is very slow. The colds are not taken from the violent cold, but from getting overheated. Congestive headaches and complaints that do not come on suddenly. So sudden is aconite, belladonna, things like that. Gelsemium is slow. They're very congestive. It slowly develops. It's thirstless. The patient is thirstless in Gelsemium. So I'm not Gelsemium. I get very thirsty. Profuse sweat, aggravated from motion. So they don't like motion. Unable to move, too weak to move. Cough with sneezing, running. I mean, this is a pretty good genus epidemicus for coronavirus.
Well, they do say it's a dry cough usually.
Mm-hmm.
And I heard there's no runny nose.
Right, that's what they say.
The news.
No runny nose?
That's what they say.
Okay.
Yeah, let's talk about that. No,
Yeah.
necessarily.
So just read through these symptoms, look at your symptoms, and there you have it. It's like a cheat sheet. We'll go, coldness in the extremities will go down into the throat and produce sore throat with redness, swelling, enlargement of tonsils, hot head, congested face, heaviness of extremities, red face, sore throat that's come on gradually, little worse from day to day until it has become a severe throat. Slowly it gets worse and worse and worse and worse. Doesn't happen like that.
It's like most colds.
See, with some babies, wham, they get a cold real fast, and then some are very slow. I tend to get it faster than Richard. Richard's colds develop more slowly. He's more Gelsemium and bryonia than I am. If you have violent vomiting, there's two remedies that are unparalleled: Arsenicum album and Veratrum for vomiting, violent vomiting. Colic and stomach aches, Nux Vomica or Colosynthus.
So one or the other.
One
Not
or the
both.
not both, yes. One or the other. And you can look at the materia medica of each or just pop one. It'll work. A cold that ends in asthma is Dulcamara. And if it still lingers after a few days, then you go to sulfur. Sulfur is what you take if your previous remedies did not work or something has been going on for a long, long time. The last resort is sulfur. If you constantly clear, that was me. After I had my cold, I would go. That's argenticum nitricum. Or rumix. Rumix is another one. If you have a saw going through a pine board, a dry cough, that's spongia. You hear that, like a saw going through pine? That's a spongia cough. If you have a barking cough, like a dog, that's heparsol. That's a heparsol cough. So, my throat hurts from that. If you have a spasmodic cough at 3 a.m., it's Kali carbonicum. So if you get up at 3 a.m. and you get this, of course you have to account for the change of timings. So the spring forward, so you go an hour backwards. If you have a tickling cough, dry spasmodic cough that gets worse in evenings, that's me. That's Ignatia. That's the kind of cough I had. A hacking cough is Drosera. Chronic sore throat is sulfur. To keep cough from going into chest, take a phosphorus 30C. The second you get a cold, it's a good idea to take 1 dose of phosphorus 30C if you are especially prone to get chest colds, because you don't want it to turn into pneumonia.
So springing forward, go to 4 o'clock instead of backwards. 4 o'clock would be 3
Yes.
o'clock.
Yes, exactly. Yeah, you're right. You're sprung forward. Daylight savings time. If you're a smoker, pepper self is one of the most wonderful remedies for cough that is loose or rattling. So you have a lot of phlegm in your chest. You're coughing it. It's kind of greeny yellow. That's a Hepar self 30C. If the cough is worse during the morning, the phlegm expectoration is yellow or pus-like. So it's kind of yellow, pus-like. It's loose, rattling in the morning. That's a Hepar self. You likely have an infection. And then there's a whole bunch of different types of coughs, and and you can look at them, or you can just look at the basic remedies and at least have those on hand. So you should never feel stressed out. You should never feel that you are lost in this giant book. So it's better to have.
That's not about coughs, is it?
Yeah, it has like 100 pages on just coughs.
Who'd have thought of so many coughs?
Yes. But after a time, you'll realize that certain things work for your family, for yourself, and then you'll keep going back to it.
Impression.
Yeah.
Should I worry if I haven't had a cold for years? And
No, you shouldn't worry at all.
Of course you should worry.
Yeah.
Colds, they help you build your immune system.
Not at all. You have a pretty good immune system. Yeah. And so,
You can
how are we
impress your
doing?
friends.
I can't remember the last time I had a
You can impress
cough.
your friends, say, oh, that's an Aconite. That's a set that kind of.
We eat so well here in Marin.
Yeah.
People eat well. We have good quality. I
And
mean,
we
we
have
haven't
good
been sick in
quality.
ages.
Yes.
Yeah.
I think you have a need to get sick when your system is full of toxins and poisons, then the body has to clear it somehow.
That's a good point.
So
Yes.
you get sick.
Yes. You tend to be sicker around little children
Yeah. I
and
know.
school
That's
kids.
really
Yeah.
why.
Children who are in daycare. I mean, my grandson. Yeah, uncannily, all of us got sick the second, and he touches and licks and drools on everything, and so he's typhoid Mary in our house.
My youngest grandsons are 11, and so, but I learned a long time ago, just like wash my hands like
Yes,
constantly when
yes.
I'm at their house,
Love them, but wash your hands.
Yes.
You're just building their immune system.
And so then I wanted to talk about dosage. For some people, a low dose works anywhere from a 6C all the way to a 1M. And you have to develop experience on what the right dose is, what the level of shock is, what the level of the symptoms are. And you'll see that some things work better for you than others. I would tend to start with a lowish dose, either 6 or 30, 6 or 12 or 30, and use the 200 only if something is very chronic, very acute, very painful, etc. How to dose? More is not more better. 1 pellet under your tongue, or take the pellet, put it in water, make a water dose. These are ultra dilute medications. These are ultra dilute nanoparticles of chemicals, and so more is not better. In fact, less is more powerful. This is not like antibiotics where you have to take a whole course for 10 days or you die. As soon as you start feeling better, you reduce or stop. And so, if someone, doctor tells you to take it for a week, you don't have to if you feel better sooner. Or you can increase the duration between each dose. But if you don't feel relief, you feel free to take it every 10-15 minutes. If you have a bleeding wound, or if you have severe pain, it's okay to take. If you have a heart attack coming, it's okay to take Aconite every couple of minutes. Or if you have a bee sting and anaphylactic shock, it's okay to take Apis instead of an EpiPen every few minutes. And then you redose if symptoms begin again, and then taper it up. So this is for a shortness of breath, and I'll send you this, and you can read it. The dosage and duration is, you use the minimum, you use it until you feel better. Remember, this is not an antibiotic, it's a very different way of thinking about it. This remedy is not curing you. It is shoring up your immune system. So it is actually the earliest philosophy on vaccines without the side effects. Mm-hmm. It is what vaccines should have been or should be. Ultra low dilutions enhance your immune system to fight a particular bug in a particular way. What this does is, it recognizes that when you have a cough, that's a good thing for your body. And you're taking a remedy that causes the same cough to cure it.
So this is the homeoprophylaxis,
Right.
vaccine they can do.
Yeah.
Do you think it's better to do that, or do you think it's better to get the childhood diseases?
I couldn't hear the question.
She was saying, is it better to take the homeoprophylaxis, or is it
As
better
a
to
vaccine.
take childhood disease? Your child is going to get diseases no matter. What the homeopathy is going to do is shrink the acuteness, the intensity, and the mortality.
So it would be like getting it, but less severe.
Exactly. So if a measles were to be
You still get lifelong immunity from it.
Exactly.
Wow.
Because
what a
it's
novel
not
idea,
suppressing
huh?
disease. So it's really awesome because it's not suppressing disease. It's
Oh, yeah.
working with it. And so they've had, I was reading this book by Dorothy Shepherd, great writer, measles, people would go blind and, it would take months, then it would turn into pneumonia. In these homeopathic hospitals, it would be 2 to 5 days. Kids would be done. And so they had their record, and they compared it to they used to call them the fever hospitals, the allopathic hospitals, where they gave suppressive treatments. And they would find that these kids either died, or it turned into pneumonia, or they spend the next 6 months going to convalescence and this and that. And they said, oh, all your cases are mild. Well, no. All the cases homeopathically treated were mild because they were rendered mild. It's not like they had the sicker kids and these people had the less sick population. This is not a supplement, so you don't take it every day. You're not taking these remedies every day. You want to read, and observe and apply it to and use your family as guinea pigs because it will not harm them. So it's okay to use it on your pets, grandchildren. The first, one of the rookie mistakes we all make is, geez, this is water. Is this really going to work? And I don't feel better 5 minutes later. And so then I start on another remedy. And then 5 minutes later, I take yet another remedy because I was not certain I took the right one before. So don't do that. First, you want to observe and think and look at the repertory and get the right remedy and give it a chance. If it's an acute, give it a chance to work. And the way it's going to work is not that the disease is going to go away, but the patient will feel mentally better. All of a sudden, from feeling terrible, they'll feel better, or they'll go to sleep, where previously they were thrashing around. When they go to sleep, that's restorative, because that's when disease gets cured. Your immune system acts up. And if it doesn't happen, if nothing happens after 4 doses, then you may go to the next thing. But first antidote it with camphor 200 before you do the next remedy. This is an antidote, or sniff some mint or some rosemary, and antidote the previous remedy, and then you can start the next one.
So as long as those are antidotes, make sure you don't take them while you're doing the remedy.
Yes, that's a good point. Yes, don't take strong essential oils while you're doing this. And how do you know it's working? That's where it requires a very different mindset than allopathic thinking. The reason allopathy has been so successful is because you apply a steroid and the swelling goes away. But you didn't cure the problem. You didn't cure that condition. It's actually, you're driving it deeper. But it's very impressive. With homeopathy, you're not going to get that. You're going to feel a little bit better, and then a little bit better, and you will not die from it. And if your fever was a raging fever for several months before, all of a sudden it will shrink down to nothing, and you'll get better faster. But the intensity will wane, the duration will wane, and your vital force, your immune system will wake up. That's how it works. So it's forcing your body to do its job, whereas allopathic treatment are suppressing your body's immune system. So the principles are very, very different in both types of thinking. And sometimes it's very hard for people. They'll say, oh shit, let me just take a Tylenol. No, you just missed the whole point, which is you want the headache, you want to take your Aconitum, and then the headache will be rooted. The cause will be taken out.
We have all those painkillers, right?
Yes.
There's addiction to painkillers.
With children, they cannot tell you, so you want to observe and you want to take notes because you will forget. I experimented on Richard a lot, and I tried all sorts of things, and if I had not written, I would never have remembered what worked and what didn't. Because he is not able to tell me. He did start to get better after a time, but I had to take a lot of notes. Kit. You need a kit. This here is a kit. Kits are cheap. They're like $2 a pop. It'll last you a lifetime. This will last me for the next 50 years. I can pass it on to my grandchildren. And you have the remedy when you need it. And these are small quantities. They're tiny quantities. They're poppy-sized seeds, little seedlets, but they work, But at the very least, you want to have a few of the remedies for conditions that are common in your family. So if you have sinusitis, if you get coughs, colds, and fevers, if you have rheumatism, if you have gout, if you have stomach upsets, if you have diarrhea, constant diarrhea, or asthma, then you want to have a set of asthma remedies, so that you have them. So a good thing to do is to write down the name of a family member and say, what do they suffer from, and have that set of remedies. Rubber band them and give them to them, or do the same for yourself. And you gotta, in order to be successful, you have to be organized. And I assume that I will forget, because I do. I just can't remember what happened 20 days ago. It's not difficult. It's like baking a cake. You follow a recipe, anybody can do it. Everybody should do it, because we shouldn't be going to ERs and doctor's appointments and pediatrician's appointments and just wasting our time, our money, and not getting success of good health, long-term success with good health. So you want to write down the date, the condition, and you want to write down a scale always. How much pain do I feel? 10 days later, if you have raging migraines that have been around for years and years and years, if you start the remedy and your migraine goes from 10 to 5, that means that remedy is working. It does not mean it's not working. The fact that it did not go away does not mean it's not working. That means it's working beautifully. And so you want to write down the scale, the remedy, and play with the potency a little bit. If it doesn't go away for the last bit, you can take a larger potency and so on. So experiment with that a little bit. But I think having little folders and you just write on a sheet of paper, date, what you gave. Like for the dogs, I do that. Agaricus worked and this other thing did not. She had a nasty odor coming out of her mouth and her ears had yeast in them, so I gave her Merc Sol and the salivation stopped, the yeasty stuff stopped, and she was well. She was tumbling around and had no appetite, and the agaricus worked. She was kind of, I didn't know if it was seizures or what, but she would stare off into a corner. And there's an exact remedy for that, stramonium. And it works. It's pretty remarkable. But you have to be very observant. It's very subtle. But you can, if you love someone or if you know someone really well, you can tell the changes. The personality changes. They become mellow. They feel better. They sleep better.
You know, you can even use your phone because it has the notes app. You can just
Oh,
talk right
yes,
into your
yes,
phone
yes, yes.
and say, today.
It's a great idea. There's apparently a note-taking app that you can use.